Hey everybody, welcome back to the channel. If you are new to the channel, you should definitely consider subscribing if you're interested into nursing CNA related topics like this. And for my returning subscribers, welcome back. This is part 2 to the Prometrics practice test. I do want to give you guys a special thank you for allowing us to reach to 300 subscribers. I appreciate each one of you guys. I make sure that these videos are to help you guys in any way, shape, or form. So I just want to give a big special thank you to that. Before I begin the video, I do want to give out a couple disclaimers. First disclaimer is that I am not a CNA instructor by any means. I'm simply just a nursing assistant that passed my CNA exam, and I want to help any of those who want to pass their CNA exam. And whatever steps I'm taking to get to the next level in my education, I'm here to help you guys with it. So through my journey, I'm with you guys through your journey in a sense. So that's my first disclaimer. Second disclaimer I do want to give out, also these disclaimers will be below, is that I do not want you guys to rely solely on just this video. I want you guys to check out previous videos beforehand and other resources outside of my YouTube channel and inside my YouTube channel to help you study for this exam. I do not want anybody to think if they just watch one video, they will pass the test. But I will say that when I studied through this packet, I did find some questions while I was taking the written exam duplicated exactly like the ones on the test. And there was some words that was changed up, but it was similar to the ones on the test. So this Prometric study guide would help you guys. The link is down below of my photos in the Google Photos of this packet that I use. I cannot find the original website. This is why I am doing a podcast style for the study guide, because my Google Photos are kind of blurry. So I do want you guys to be able to hear me and study. Now in this podcast, I'll be doing 10 questions each segment. I would rather you guys just understand fully, have the answers to the back of your hand with 10 questions per segment, than throw 30 questions with a 1 hour podcast. Personally, when I break down my studying into segments, I understand it way more than when I cram it all in. And you will be hearing my voice. I feel like when you hear a human voice, you will understand the material more. So without further more of me rambling, let's get straight into the practice test. Question 1. Which of the following is most important to closely observe when a resident wears elastic stockings, the type that worn to help circulation? Is it A, the resident shoe fits, B, the resident pulse rate, C, the way the resident walks, D, the color of the resident's toes? And I'm going to give you guys some time. I always like to give you guys some time. This is to practice that muscle memory of having critical thinking skills. So think about it. What is the most important thing to observe when one of your clients, one of your patients is wearing elastic stockings? And for those of you who don't know what are elastic stockings, they're mostly compression socks, the type of stockings that very compressed, very stretchy to your feet, and it's to help circulation on your feet. Usually these type of socks are recommended to diabetics from my understanding and my experience. Okay, I'm going to give you guys the answer, and the answer is D, the color of the resident's toes. And here is why. When a resident is wearing elastic compression stockings, they generally have an opening to the toe area to allow circulation to the feet to be checked. If circulation is poor, the color of the toes will change. Depending on skin color, the toes may appear red, blue, purple, or dark. Any changes in the skin color should be reported immediately, and the stocking should be removed. Which makes sense because when you are applying stockings or socks on somebody, on your patient, when it comes to the compression socks, compression stockings, elastic stockings, out of all of the options you have, A would not be the answer because the resident's shoe is not something to pay attention to if the question is directed about stockings. So that is already canceled out. That's canceled out. If you're focusing on one thing and something else is related to it, that is how the test would trick you. You would think shoes, stockings, pay attention to their shoes. No. The resident's pulse has no relations to their stockings. Yet again, when you're putting on stockings, you don't need to pay attention to their pulse rate on how they're breathing. The way they walk will be a tricky answer for you to pay attention to, and as you should. When you're in the work field, you should be paying attention to the way they walk if they're comfortable. But before you know they are comfortable by the way they're walking, is the color of their toes. The color of somebody's skin tells you a lot about their health, the pain they are in, all types of answers. So pay attention to the color of their toes. And another tip, when a resident wears elastic compression stockings, it's important to make sure that the stockings are not twisted and wrinkle-free. Also make sure that the top of the stocking is flat and not folded. There is a proper way to put on elastic stockings, and it will be on your skills test. For those of you who want to know how to study your skills test, the link is right above for tips and tricks that I use to pass my CNA skills test exam. Question 2. A resident must have assistance to walk. When leaving the resident's room, what must the nurse aide do before leaving the room? Is it A, turn on the resident's television? B, make sure the resident's pan is within reach? C, place the call light where the resident can reach it? And D is a human misspelled error of mine, so let me pronounce it quickly and correctly. Instead of SAT sat, I meant to say SAY say. So say to the resident, remember that you need help to walk. Now you ask the CNA, what would you choose to do for a resident that need help, assistance to walk, but you have to leave the room? And there's going to be moments, many moments actually, when you're on the field, on the site, assisting with residents that cannot walk for various reasons, such as wheelchair bound, incontinence, etc. And you're going to have to attend to other residents. So what would you do before you even leave the room and let the resident be? I'm going to give you some time to think about it. Okay. The answer is C, place the call light where the resident can reach it. And here's the reason why you should place the call light where the resident can reach it. The call light should be within reach when leaving a resident in his or her room, regardless of if the resident is able to walk or not. Leaving the call light within reach is especially important for a resident that has limited mobility. Not only should the light be within reach to allow the resident to call for assistance, the nurse aide, you as the CNA, of course, should also make sure that other items the resident might need are safely within reach. Many falls occur when residents are trying to get personal items when they're not left safely in reach. If you use process of elimination, answer A, turn on the resident's television. Let's put us in this scenario. We're CNAs, right? You're a CNA. You're new to the floor. You have a resident. I'm giving you a resident. You have 10 patients. One of them cannot walk. They need assistance walking. You have to attend to 9 other patients. The last thing you're going to do before you leave the room, are you going to turn on the TV? If they don't care for TV, they're not going to need it. It's not going to be relevant. It's not going to be the most important thing to do. So turning on the TV is cancel out. There's a lot of factors why turning on the TV is just not relevant to the scenario. B, answer B, make sure the resident bedpan is within reach. This is why these questions will try to trick you guys up. It will try to trick you guys up. The bedpan is not going to be an answer. And let me tell you why. If this resident, just because they need assistant walking, doesn't mean they're incontinent. Some people just need assistant walking, but they can know that they need to pee, and they can tell a CNA, I need to pee, and the CNA will help them walk into that bathroom to pee on the toilet, or urinate for the correct term. So the bedpan, they're just trying to trick you up. The bedpan to be near, that's not the most important thing. If you do not know what's in the care plan, do not pick it. If you do not know what's in the care plan, do not pick it. So the bedpan is the least important thing, because they could just be using Pampers for all we know, right? D, say to the resident, remember that you need help to walk. Now, remember, we're putting you in a scenario. You're a new CNA. You're on the floor. The resident needs assistance. Will you tell the resident, remember, you need help to walk? If you're new, you're going to forget. And if you are a veteran, for those veterans out there, even if you're a veteran and you get to the point where you've been a CNA for 1 year, 2 years, and counting, you're not going to tell your resident, remember, you need help to walk, because there are some residents, some patients you will have that have Alzheimer's, they have dementia, and they're not going to remember. Unfortunately, this is just the world we live in. So the most important thing to do is to place the call light where the resident can reach it. The call light is solely for you. It's to help you. It's to help them. It helps each one of us. If the resident calls, you see the bell, you come, you attend to their needs. Regardless if they need to walk, maybe it's some other personal issues. That call light is a communication signal that, hey, I need help. Please help me out. You come in, you check on them. And that's why the call light is highly important. I want to install this into you guys, that the call light is so important to place. So important to place that, from my experience, I had a patient who got up to use the bathroom that needed assistant walking. And I wasn't aware. The only way I was aware is because I saw that call light bell. If the call light bell was not in reach, who knows what could have happened to her. But because of that call light bell, I had the signal to, okay, my patient needs help. Let me attend to her. So I want you guys to strictly remember, put that call light bell in reach for your patient. And I also talk about it in the orders of operation, beginning and ending, for your skills test. For those of you who still has not seen that video, I do recommend watching the video, but do not watch it until you finish this video, because that video is very lengthy, and I broke down many tips I use to pass my CNA skills test. But just want to remember, place that call light where they need to reach. It could be on their bed, near their pillow, or in their hand. That's how important it is that I want you guys to remember. If you see this question, it's the call light. If you're in the field, you're going to remember, just put that call light there. This is just one of them questions that it will carry you throughout the CNA experience. Question 3. A nurse aide enters the room to help the resident to the bathroom. A trash can in the room is on fire. What should the nurse aide do first? A. Use the resident pitcher of water to put out the fire. B. Open the window to get the smoke out the room. C. Yell fire along with the room number. D. Remove the resident from the room. Now, I'm going to give you guys some time to think about it, but while you are thinking, close your eyes and put yourself in the scenario. You are your future CNA self. You're on the job. You have a patient. That's your assignment. One of the patient has to use the bathroom. All of a sudden, for some odd reason, the trash caught on fire. What would be the first thing you as a CNA do? Would you take the pitcher of water and put out the fire? Would you open the window for the smoke? Would you yell fire, or would you remove your resident from the room? I'm going to give you guys some time to think. And as per usual, we're going to go over the correct answer. The correct answer is D. Remove the resident from the room. And here's why it's important. When a fire presents an immediate danger to the resident, immediate means that it's right directly close to your patient, the first response should be remove any resident from harm. If any of you guys was told in your CNA class, this acronym, RACE, RACE, is the steps to remind staff of the following response from a fire emergency. So R is removal of the resident from danger. A is alarm. C is confine the fire. E is extinguish. Now, let's start talking about process of elimination as usual. Your options is A. Use the resident's pitcher of water to put out the fire. I personally would not recommend anybody to try to take out the fire. That is for the professionals to do, and the professionals are the firefighters. Let them fight the fire. That's not your job. You're a CNA. You're not a firefighter, so you don't need to take out fire. That is why it is canceled out. B, open the window to get the smoke out the room, which is a pretty good option. I do not knock anybody, for wanting to pick that option, but it's not the immediate thing. That would probably be like the second thing you will want to do, or probably even the third thing you will want to do. Remember these questions on the Prometric study written exam. They're going to basically ask you about what's the most important thing. And what I'm realizing in the nursing field, questions they ask you while you take these tests is they want to know what is the most important thing you're going to do. Because while you're in the nursing field, you as a CNA, you are considered to be in the nursing field. Do not let anybody tell you any less. Do not, okay? Don't let anybody belittle your part you play in the healthcare field. And do not ever feel bad for going to school, passing the test, being a CNA. Don't feel bad about it, okay? Don't. I don't want anybody to feel bad about being a CNA because you are in the nursing field at the end of the day. I don't care what people say. CNA. Do you hear the nursing part? Nursing assistant. My apologies. I went on a little tangent, but I do wanted to state that and talk about that. Now, B, open the window would be the third thing as the third option, but it's not the most important. They're going to try to trick you. They're going to try to basically ask, what is the most important thing you're going to go to? C, yell fire along with the room number. It's smart to let everybody else be aware that there's a fire. That's good. But D would be the correct answer. It is the most important thing to do is to remove the resident from the room. Your job as a CNA is to always protect your patient. Rather, it is just doing simple things as giving them a bath, you notice a spot on them, and you report it to the charge nurse, or big things like removing them from a fire that is in immediate danger from them. And even if the fire is far, say there's a fire in the lobby, your job is to make sure all your patients are out and safe. So the answer would be D. Question 4. The term vital signs refer to A, any important information about a resident's condition. B, the color, condition, and appearance of skin. C, fluid intake and output, as well as bowel movement. D, temperature, pulse, and respiration. Now, I'm going to give you guys some time to think about what it is. I do always encourage you guys to take the time that I'm giving you so you can use your critical thinking skills as a CNA. And those of you who already know the answers, that is good. Those of you who don't, it is okay. I'd rather you guys fail this practice exam while you're watching the video than pass it. Because if you fail it, you're going to get it right the next time. And if you got it the first time, it's even better, you know? But if you don't get it right, if you don't know what vital signs mean, it's perfectly fine. See, part of the process of studying and learning is to get it wrong, to get it right, if that makes any sense. You remember what you get wrong to correct what to do right. It's kind of like you learn from your mistakes in a sense. And I do encourage you guys to not skip over the time of thinking about what this answer could be, because when you take the time to think about what it can be, it will help you when you take the exam. Because when you take the exam, they're not going to give you the correct answers. They're not going to go over why it's correct. And the correct answer is D, temperature, pulse, and respiration. The reason why it's correct is because the term vital signs refer to the measurement that provide information on the functioning of major organ system in the body. Measuring pulse and blood pressure provides vital sign information about the cardiovascular system. And the cardiovascular system is anything referring to your heart. You know, like the word cardio, heart. Measuring respiration provides information about respiratory system. And respiratory system is like your breathing. Monitoring body temperature provides information about body system, including the immune system. So instead of using process of elimination, I would rather you guys just remember the term vital signs, and the definition is just meaning anything that you can measure. So if these option A, important information about the resident's condition, you can't measure that. the color, condition, and appearance of the skin. You can't measure that. Fluids intake, output, as well as bowel movement. That will be the tricky question. Vital signs. You can measure your intake and output. But how I separate vital signs is anything that's vital to your well-being. Your well-being. If your temperature is high, that's vital. If your pulse is low, that's vital. If your breathing is low, that's vital. If you ever heard the term vital, important. So what is important? Measurement. So that's how I remember the term vital signs. I would just like you to solely focus on the term vital signs. And another thing, that when you're doing the scales test, they're going to give you a measuring scale. And one of the measuring scale might be a vital sign, because vital signs you have to measure. Question 5. Which of the following describe an important requirement when providing colostomy care? Is it A, use sterile technique when providing care? B, wear gloves for standard precautions? C, avoid cleansing skin near the stoma? D, position the resident on the side? And I'm going to give you guys time to think about it. This might seem out of the blue type of question. It might feel a little tough. So it's perfectly fine to not know. Think about your colon. Your colon is your large intestine, which is connected to the anus. And the anus produces feces or bowel movement, aka poop. So just think about that. The correct answer to question number 5 is B. The reason is because colostomy care involves possible contact with like feces, poop. The nurse aide is expected to wear gloves as part of the following standard precaution. Standard precautions also require that nurse aide will clean hands before having physical contact with the resident, and will do the same after removing the gloves. Hands should be clean as the final action when resident care is completed. So remember to wash your hands before and wash your hands after. That is the number one thing. Especially with this whole pandemic going on, washing your hands is very important. While you're in the nursing field, washing your hands always been important. So you should remember to wear gloves, wash your hands before and after. Now, going over the options we have using sterile technique when providing care, which is A, that could be the answer. That's a good option. C, avoiding cleansing skin near the stoma. D, position the resident on the side. These options could be really good. They threw in some good options to trick you guys. But the most important requirement, you see those two keywords inside the question, important and requirement, is to wear gloves. Protect yourself by protecting them. You're protecting them by protecting yourself. It goes full circle. Wear your gloves, keep cleanliness. This is to help you. So if you do see this question pop up, or if you are in a situation where you have to provide such care like that, remember to wear gloves. And I believe that you guys are going to be great CNAs, first of all. I already know that. But on top of that, I know that you guys are going to be wearing gloves for mostly everything and anything that you do. So I'm not too worried about it. But think about it. If you're in the field, you got to put on your gloves in a scenario like this. I would, if I was new to studying, I would pick A. But it's so tricky to make sure things are clean. You you forget that you have to keep yourself clean too. So B would be the most important requirement, and that's what makes it the correct answer. Question 6. A nurse aide is giving a resident a bed bath. Which of the following should the nurse aide do during the bed bath? Is it A, keep the bed in the lowest position throughout the bathing? B, keep the resident's body covered during the bed bath? C, open the window for fresh air during the bed bath? And D, add a lot of soap to the water in the basin. Now, I'm going to give you guys time per usual. And the answer is B. And the reason why the answer is B is because when bathing a resident, it's important for the nurse aide to protect the resident's privacy and limit exposure to only the area being washed. When bathing a resident in bed, raising the height of the bed to working height is important for the nurse aide body mechanics. Opening the window for fresh air might be helpful to the nurse aide who is working and moving, but it could chill a resident who is wet while being bathed. When bathing a resident, the amount of soap used is limited because of the resident's dry skin. It's also important not to add soap directly to the water as it affects the ability to have water from rinsing. Which make very much sense. It is very, very, very important to keep your patient private by all means. So covering them up and only exposing the necessary area is why the answer is B. You don't want to lower your bed because it's going to hurt you while cleaning them up. One thing I noticed when I first started as a CNA is that the CNAs that are experienced, they made sure to tell me to make the bed as high as you can, because being a CNA is going to be a lot of labor work on your back. So the less you make that back ache, the better it is for you to do that job. So don't lower your bed. I don't recommend that. Opening the windows is not necessary at all. And adding soap, to be honest, most of your patients, if they are older, very older, like 65 and up, they would just wash up with water and minimal amount of soap. So just keep the resident body covered. You will know this is necessary when you do skills or look over your skills, that you have to cover your resident when you're given a bed bath. Question 7. Residents are most likely to feel the urge to have a bowel move. A, after taking a nap. B, after eating a meal. C, just before bedtime. D, during a shift change. Now, I'm going to give you guys some time as usual. And we're going to go over the answer. So the answer to this question is B, after eating a meal. And for those of you who don't know what bowel movement means, it is just pooping, aka bowel movement can be a BM for shorter terms. The reason why the answer is B, after eating a meal, is because bowel movement habits are very individual and varies from person to person. Many individuals will feel the urge to have a bowel movement in the morning after breakfast. This is the result of gastrointestinal system becoming more active after less activity during the night, giving residents the opportunity to use the bathroom can be supportive in helping residents stay regular. the resident. After eating, the food passes from the stomach into the small intestine, where nutrients are absorbed. The end product of this process is movement of feces through the final section of the intestinal tract, or your colon. The stool is moved through the colon and passes through the rectum. The presence of the stool in the rectum is the signal that gives the urge to have a bowel movement. Ignoring the urge to have a bowel movement contributes to constipation. To help prevent constipation, it's important to provide assistance for toileting promptly when the resident feels the urge. And I read that from the Prometric study guide that I'm taking these questions off of. So if you really think about it, you're most likely to have a BM, or your patient is most likely to have a BM right after eating a meal. It wouldn't be after taking a nap or just before bedtime or during shift change. You're most likely to have a BM right after you eat a meal. So that is why the answer would be B. Question 8. A resident likes to eat breakfast in the dining room with other residents. The resident is slow when getting dressed each morning. So residents' friends are often leaving when the resident gets to the dining room. The nurse aide should A. Set out clothing the resident can dress in more quickly. B. Dress the resident to make sure the resident gets to breakfast earlier. C. Ask if there's any help the resident would like in the morning. D. Remind the resident that their friends will be at activities later. Now I'm going to give you guys some time as usual. And the answer is for question 8 is C. Ask if there's any help the resident would like in the morning. The reason for this is because it's important that the nurse aide understands residents' rights and the needs for residents to be involved in their own care. In this question, a situation is posed where a resident is independent in dressing, but dresses more slowly. Independence is important, but so are the residents' social needs. So you need to allow the resident to go forth in dressing themselves. The most respectful response is to ask the resident about the resident's preference, which allows the residents to have control about the resident care. The nurse aide can suggest options that might help the resident be ready early, but it's important that the resident be allowed to make the decisions. So prepping their clothes will not help them make their decisions. Reminding them that their friends will be seen in activities later will just discourage them. The best option for you to do is to ask, especially since your resident is independent. Question 9. Why is it important to check the feet of a resident with diabetes at least twice a day? Is it A, to look for sores on the feet the resident may feel? B, to check if vision problems have resulted in foot injuries? C, to trim the toenails so they do not become longer or jagged? Or is it D, to make sure the resident does not get foot fungus? Now I'm going to let you guys think on this. We're getting closer to the end, so hang in with me. And the answer to this question is A, to look for sores on the feet the resident may not feel. because the patient with diabetes should have their feet checked by the nurse aide, which is you, the CNA, at least once a day. Because of changes in circulations and nervous system, individuals with diabetes often have poor sensation on their feet. They literally cannot feel sometimes. A resident with diabetes can develop a small wound on the foot that can go unnoticed, and that wound can get infected. The wound can become worse and require medical intervention and even, unfortunately, amputation. It does happen sometimes. This is why residents with diabetes should never walk around barefoot, as the resident can injure the foot and not realize there's a wound. Diabetics also do not heal as well, especially when the blood sugar is not well controlled. Anytime the nurse aide has the opportunity, such as when dressing, undressing, or bathing a resident, the nurse aide must be certain to inspect the resident's feet. Any changes noted, such as open areas, cracks in the skin between toes, or even redness, should be reported to the nurse immediately. And this is very important. Like, you ask the CNA when you're bathing your resident, or say you have a new resident or patient coming into the facility, always check on their body. Always check. If you see a new mark on them, report it. It's to save you. So that's why the answer would be A, to always check their feet, because diabetics, they cannot really feel their feet sensation. They don't really have quick reflexes when it comes to their feet. So it's always good to check their feet. It wouldn't be B to check if vision problems has resulted in the foot injury, because they have no correlation. It wouldn't be C to trim the toenails so they do not become longer, because usually if they are diabetic, they will have a doctor that literally trims toenails. There are doctors out there that just are specific to feet. And D, to make sure the resident does not get foot fungus, would kind of be the answer, but overall, in order to make sure they don't have foot fungus, is by checking their feet. Okay, guys, I want to congratulate you. We are on the last question, and this is question 10. When a person is receiving end-of-life care, the resident care plan is likely to include A, ways to best provide for the comfort of the resident. B, exercise to help improve the resident's strength. C, frequent observation to help prevent confusion. D, instructions for providing post-mortem care. Now, I want to give you guys some time. While I'm giving you guys some time to think about it, I definitely do want to thank you guys so much for completing this studying with me. We are in this together. I definitely want to give big shout out to all of you guys in the community, helping each other out with the CNA. Like, I love seeing the support. I'm just proud of you guys. Like, keep up with the work. You're gonna do good. I don't want nobody to be feeling nervous about this. And I definitely keep promoting water, because like my mother will always tell me, and I'm gonna throw the accent, water is medicine, because it is. Water is medicine. So that is gonna help your health be better, ease your mind and brain when you take this test. Now let's get straight into the answer. The answer to question 10 is A. The reason why is because end of life care focus on addressing care to meet a resident's need for quality of life. This care includes focus on providing for the resident's comfort. So most of the time when it comes to end of life care, it will be related to hospice, the field in nursing, because your resident or patient will be passing away. Their care plan will be focused on just making sure they're comfortable, because it's inevitable that they are going to be passing. They're on the verge of passing at that point. They're probably on life support. So it will just include you just providing comfort and making sure that they're physically, mentally, well-roundedly comfortable. You wouldn't be exercising to improve their strength because they have no more strength. That's why they're at the end of life care. You wouldn't be using frequent observation to prevent confusion. Their body is slowly shutting down in a sense. And then D says instruction for providing post care. Like, there's no post care when it's end of life care. It's the end of life. So the best option for you to do would be A, provide best comfort as much. Okay, you guys, congratulations. I am super proud that you completed this study with me for practicing. You guys are going to do so good on your CNA test. You really are. I don't want anybody to self-doubt themselves. Number one thing we're not going to do 2021 is self-doubt ourselves. You have it. Trust your gut feeling. Drink your water. Calm yourself. And don't stress yourself the day before. Don't even study the day before, because you've been studying. You've been taking the steps to pass this test. You've been doing everything you need to do. I honestly hope this video helped anybody. If it did, make sure you just leave a like, so YouTube can recommend more videos soon. If you guys took anything away, is that I just want you to take is that failure is only failure when you stop trying. That's all. Failure is only failure when you stop trying.